All right. Good afternoon, everybody. It's 4 o'clock, and I will call the City Plan Commission meeting to order. I'll quick call the roll here. Braden? Here. Jerry? Here. Kim? Here. Joe? Here. Kevin? Here. Mike? Here. All right, gang's all here. If folks could please stand for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. All right, is there approval of the minutes from our last meeting?
So moved.
Moved and seconded. All those in favor of approval of the minutes, state aye.
Aye.
Any objections? Chair votes aye. Minutes are approved. Thank you. All right. First, we have a public hearing. Public hearing regarding 2025-2029 consolidated plan and include the 2025 annual action plan. Anyone from the public wishing to be heard on the consolidated plan? Anyone from the public wishing to be heard? Anyone wishing to be heard? Seeing none, is there a motion to close the hearing? Moved and seconded. All those in favor state aye. Aye. Any objections? All right, hearing is closed. Next item for possible action, application for special use permit by Lauren Hydock to operate a wellness studio located at 729 New York Avenue. Elise, staff report.
The proposed use is an expansion of an existing business located within the same shared business space. The classes include strength, kickboxing, chair, and mat classes. There are currently 8 employees and 120 members.
Thank you. Applicants, any additional comments you'd like to add? Nope. Okay. Questions from commission members? All right. Moved and seconded. All those. Huh? Oh yeah, any further questions? All right, all those in favor, state aye. Aye. Any objections? Chair votes aye, that's approved. Easy enough. All right. Next, next item 7, direct referral resolution 50-25-26 by Alder Close, approving the 2025-2029 consolidated plan and 1-year action plan for housing and community development, utilizing community development block grants funds through the United States Department of Housing and Urban Development. Kristen, what you got?
Thank you for the opportunity. I'm Kristen Fish-Peterson, consultant to the City of Sheboygan for CDBG, and I've been working with the Community Development Department since probably November, December of 2024. This plan is, the consolidated plan is a 5-year plan, and it also includes our 1-year annual action plan for how we will spend the CDBG dollars that are allocated to us in an entitlement. Our annual entitlement is approximately $910,675. So every 5 years we come up with the 5-year plan, and every year you'll see this 1-year action plan coming to you for approval. So it's our 5-year plan. We have put it together. It's about 140 pages long. I don't know if anybody took the time to read it, but it includes a lot of data, including public input. And fortunately, last summer, there was a public survey that went out specifically for this study. We had about 700 respondents. I also conducted interviews along with 2 staff members from the department of all of our public service subrecipients, as well as the Public Housing Authority, and a few other public service entities. We also put out applications for the public service dollars. So the way the budget works, of that $910,675 annually, the city can spend 20% of those dollars on admin, 15% on public services, and the other 65% on other activities that we might, as a city, might agree are needed based on community needs. So we went through the whole community needs assessment, housing assessment, homeless. We looked at all of those factors and came up with the top needs, which include housing, blight elimination, homeless needs, mental health was mentioned, and public facilities to benefit LMI. Those were all included in the top community needs. So we look at what the 5-year budget might look like, and I just basically took the annual budget and multiplied it by 5, knowing that we also have program income from 2 revolving loan funds that the city has been a steward of over the years, one for businesses and one for homeowner rehab. So we have program income dollars in addition to the annual allocation that we get from HUD, so that gets programmed in. And then we think what other funds might be available. So in one part, we identified a potential maybe $200,000 from TIF that might participate in a project. And we put this 5-year plan out there knowing that it's a goal. It's not something set in stone that the city has to achieve, but then we report on it every year. The CAPER, which is the annual report, performance report, isn't ready yet for 2024. We prioritized the consolidated plan, knowing that the department is short-staffed, and HUD was okay with that. They said, don't worry about the CAPER, you properly prioritize the consolidated plan, so we're good there. And this plan now is set, hopefully, with your approval today and the city council's approval at their next meeting, will be on deadline with HUD. So we'll be in good standing with HUD to get this in on time, which is kind of a big accomplishment, knowing that I came in kind of cold and there was nobody left in the city staff to do this large document. So we're good. That's the good news. I can answer specific questions, but we did have public service applications for more than the dollars that we could allocate. So a team of internal department heads met around those applications and recommended dollars. And those are the recommendations you see, I think, let me see, they're around page 99, where we start the annual action plan. So the public service subrecipients would include for this year specifically Lakeshore Cap for $20,000, the Abode for $26,460, Shoreline Metro for $42,493, and the Salvation Army for $47,000. Those 4 subrecipients total that 15% of dollars that we can allocate toward public services. And those are trusted subrecipients that the city has used in the past and had good results with those. So we also allocated $20,000 to Partners for Community Development because they fall under a different bucket of homeowner rehab and down payment assistance. Then we identified some acquisition and remediation dollars, and then the 20% that we can use for admin. Are there any questions?
Questions so far? Okay.
When you listed, was it 5 things close to the beginning? Could you read those again for me?
The needs,
Yes, please.
housing, blight elimination,
Blight,
got it, yep, which is an eligible expense under HUD. Homeless needs, mental health, and alcohol and drug abuse support. Those were listed as community needs. And then public facilities to benefit LMI. What that category
yeah,
is,
what's LMI?
low to moderate income people.
Got
All
it.
of these dollars have to benefit low to moderate income people.
Got it.
So if we make improvements to public facilities, that would be parks or other public facilities in eligible census tracts. So we make sure it's in an eligible census tract where 51% of the population or more is at a certain level of poverty.
Okay,
And then we can spend money on streetlights, streets, sidewalks, any kind of public facility like that that benefit those neighborhoods, including park facilities, restroom facilities in parks or shelters, bus shelter stations, that kind of thing.
thank you.
Mike?
Yep, so you have the list on page 101, or 139 in our agenda packet of the list of different projects and the project name and the funded amount. I'm just wondering, how were all of these groups determined? You had mentioned earlier that there are groups that had worked well with the city in the past. Is there any metric or anything that you're following? Thinking of something similar to like the United Way or something like that, where they look at benefits per dollar and things like that.
Sure, one of the things we did look at, and we had a meeting with as many department heads that could attend. So we had the department, we had the fire chief, we had the library director, the director of the Uptown Social, thank you.
We had HR there, we had facilities there, we had a whole array
Please.
of people. We acknowledge that a lot of the departments have served the entire area, and that involves LMI tracks.
Right, and they do have direct access or interaction with people in each of these areas. So we looked at the limited dollars that we had, and the people who, like Lakeshore Cap, the Abode, and Salvation Army all serve homeless. We don't offer any other services or money to help the homeless, so we want to get it to the dollars that do help the homeless. So those were prioritized for that. And Shoreline Metro, ironically, there was a huge, when I did the interviews of all the public service subrecipients earlier this year, not only did Shoreline Metro say there's a demand for transportation for low to moderate income people in the city, but other subrecipient organizations, other public service organizations said these people need transportation to jobs, medical, shopping, education opportunities. So it felt like an underlying theme that transportation should definitely be funded. So if the Shoreline Metro is picking people up in low-income neighborhoods and taking them to work or medical appointments or grocery shopping or things like that, that's definitely a good investment of the dollars.
Okay, thank you.
Yes.
All right, other questions? Cool. Anything else, Kristen?
It's a pleasure to work on this.
Hey, we appreciate it. All right, seeing no more discussion, anyone else wishing to speak on this? Is there a motion to accept and approve? Moved and seconded. Final thoughts? Seeing none, all those in favor state aye. Aye. Any objections? Chair votes aye, that is approved. Next meeting, July 15th. We've exhausted our agenda. What is the pleasure of the commission?
Second.
Moved and seconded. All those in favor? Aye. All right, we're adjourned, 4:12. Good job, everybody.